Hypertension is responsible for more deaths and disease than any other biomedical risk factor worldwide. It's considered to be the major risk factor for stroke and coronary heart disease and a major contributor to congestive heart failure and chronic kidney disease. Risk factors for the development of hypertension include obesity, chronic stress, poor diet, high salt intake, high alcohol intake, age, and also physical inactivity. To address hypertension, it's important to initiate a comprehensive management plan to reduce blood pressure, reduce overall cardiovascular risk, and minimise end organ damage. This involves advising on lifestyle risk reduction for all patients, especially those with high to normal blood pressure or hypertension. Coenzyme Q10 would be the primary recommendation for managing elevated blood pressure. A deficiency of this nutrient has been found in hypertensive patients, and meta-analyses have found a significant antihypertensive effect. The effect size for treated or untreated hypertensives is a reduction of between 11 and 17 millimetres of mercury in systolic blood pressure and 7 to 10 millimetres of mercury in diastolic blood pressure. Therefore, CoQ10 can have a potentially beneficial additive effect to pharmaceutical antihypertensive agents. Omega-3 fatty acids from fish oil can also reduce elevated blood pressure. Their effect is more modest, however they confer many other benefits for cardiovascular health. To have a benefit on blood pressure, relatively high doses are required, with a meta-analysis indicating that a mean dose of 3.8 grams per day of EPA plus DHA was effective. Both CoQ10 and fish oils are well tolerated and can be used alongside most other medications. But note that CoQ10 may increase or decrease the anticoagulant effect of warfarin, so use with caution and monitor, as you would any patient taking warfarin. Another complementary medicine recommendation could be magnesium. Magnesium modulates vascular tone and reactivity, and low levels of magnesium are associated with higher blood pressure. A deficiency can occur in some hypertensive patients. However, there have been mixed findings in supplementation studies. Magnesium can be taken alongside fish oil and CoQ10. Improving or maintaining fitness is important. Therefore, an exercise program should be tailored to suit your patient. At least 30 minutes of moderate intensity exercise on most days of the week can reduce systolic blood pressure by around 2.5 millimetres of mercury and diastolic blood pressure by an average of 4 millimetres. Maintaining a healthy weight is also important, as every 1% reduction in body weight can lower systolic blood pressure by 1 millimetre of mercury. Decreasing alcohol consumption can reduce systolic blood pressure by 3.8 millimetres of mercury, and hypertensive patients should limit their intake to a maximum of 1 standard drink per day for women and 2 for men, with at least 2 alcohol-free days per week. As far as diet goes, there are a number of well-defined guidelines. Firstly, reduce salt. High dietary sodium is linked to increased incidence of stroke and risk of death due to coronary heart disease. Reducing intake to 1700 milligrams of sodium per day can lower systolic blood pressure by 4 to 5 millimetres of mercury in patients with hypertension. So limit salt intake to 4 grams a day or less. Alongside decreasing sodium, encourage patients to increase their potassium-rich foods, such as fruit and vegetables, legumes, and plain unsalted nuts. Increasing dietary potassium by around 2,000 milligrams per day may reduce blood pressure by 4 to 8 millimetres of mercury in hypertensive patients. The DASH eating plan, or Dietary Approaches to Stop Hypertension, was developed to incorporate a low-sodium, high-potassium approach with an emphasis on fruit and vegetables, whole grains, fish, poultry, beans, seeds and nuts. For more information on the DASH diet, visit the web address on the screen. Also, in addition to the DASH diet, you can recommend that your patients include garlic. Meta-analyses have found that garlic may reduce systolic blood pressure by 8 to 16 points and diastolic blood pressure by 7 to 9 points. Your patients will need to consume 2 to 5 grams of fresh garlic per day or alternatively the equivalent of aged garlic extract. All in all, the Mediterranean diet is a great model to follow. So recommend plenty of fresh fruit and vegetables, oily fish, a handful of raw nuts each day, olive oil, plenty of fibre, and perhaps as a treat, even a glass of red wine.